I'm Jo Zinger. I'm the Health Improvement Lead. And one of the things that I look after is the free condom service. Myriad, who will give you a wave, you've already all seen actually anyway. You may have heard the name over the last few months, but Myriad is new to the team and she's our Senior Health Improvement Officer. She's the lady that deals with the day-to-day running of the service, and I'm just her bossy boss, basically. And I take responsibility to make sure everything's running to plan. And Alison Crawson, who will give you a big wave now, is really our boss, okay? She keeps Myriad and I totally in line, and she's the one that makes sure that everything that you guys need actually happens. And she's our senior business administrator. And those of you that have been a venue for a number of years will know Alison very well, or she's the person on the end of the email that sorts out any problems that you have, you sign up and things like that. So as I say, she keeps us all in line. Okay, has anybody got any questions about anything before Myriad kicks off with giving you an update on where we're at and what we're doing? No? Okay, Myriad, I'll hand over to you.
Okay, thanks very much, Jo, for that introduction. And it's great to see a number of you here this afternoon. I'm delighted to be able to get the opportunity to engage with some of you. As Jo had shared, I'm relatively new to the team, so this is a good opportunity for me to kind of get to meet a few more people. So what I'm going to do is I'm going to give you a little bit of background information, and then also just going to share what we've been up to in the last wee while, and especially during COVID, and our service developments as well. So for those of you, the aims and objectives on the service, this will be something that you're very familiar with, but there may be some of you who are maybe relatively new to the service, or it's been a while since you've engaged with us. So we thought we'd just give you a bit of a reminder about what we're trying to do with the free condom service. So it is a public health intervention contributing to Sandyford's key outcomes of reducing the transmission of HIV, STIs, and reducing unintended pregnancy as well. And it is a universal service available to anyone aged over 13 years. We get our direction from a number of policies and frameworks, in particular the Reset and Rebuild Recovery Plan developed by the Scottish Government, the Sexual Health and Bloodborne Virus Framework, the Women's Health Action Plan, Pregnancy and Parenthood and Young People Strategy, and as well from Healthcare Improvement, Scotland Standards for Sexual Health, and also we look to the NICE guidelines as well. So all of our the work that we do is firmly established within policy and framework, and helps us to ensure that we're delivering an effective service as well. Our primary objectives are to increase the availability of condoms, reduce barriers accessing condoms, because we are aware that some people do face more barriers than others to accessing services, in particular condoms. We want to normalise condom use as well. There's still a stigma around using condoms and asking for condoms as well. So we want to try and reduce that and make it as easy as possible to access. It's a free service for the public, and there's no costs to distribution outlets who are delivering the service as well. And we want to support our priority groups. So those are those living with HIV, people at risk of HIV, young people aged 16 to 24, sexually active young people 13 to 25, and those in areas of deprivation as well. So although we are a universal service, we want to make sure that our services are in the right places for those most in needs, and in particular those in our priority groups as well. So as you mentioned before, there's been quite a bit of change within the team, and obviously we've had to adapt to COVID-19 and our ways of working, as all of you will have done as well. So we thought it'd be useful to give you an update about how we've adapted the service, and how we are working, and the developments that we're undertaking. So the service itself is actually in its 11th year, so established in 2011. So thanks to you all for supporting us, and those that are new as well over that time. And in response to COVID-19 and outlets being closed, reduced hours, also just to make sure that we're keeping the staff and public safe with regards to social distancing, we implemented a temporary postal service in 2020. Obviously, I wasn't in the team when it was established, but the team worked really hard to get that sorted in a really short space of time and during really challenging and difficult circumstances. And it's now a well-established part of the service as well, of having this postal service available to the public. So this involves being able to order free condom products via the website that's then delivered directly to individuals' home. It's all very discreet, plain packaging, and again, the principles of the service, very limited details that are taken regarding the individual that is ordering the condoms. So in the last financial year, there's over 6,000 orders of condoms and lubricant via the postal service, which equates to over 149,000 condoms that have been distributed to the public via the postal service. So yeah, again, a successful part of the service that was established just to ensure that we were responding appropriately to the circumstances that we all found ourselves in the last couple of years. So some of the other service developments that have been undertaken over the last wee while, we have a new national tender for condoms and lubricant that was commissioned in 2021. We continue to work with Pisanti. We've worked with them since 2011. There has been a slight, increase in product prices with the new tender, just with there hadn't been an increase in a while. But in particular with latex-free condoms, there has been an increase around that. So we are encouraging outlets to think about which products they need for their service users, just to make sure that we are, using our budget appropriately. Also, with regards to Pisanti, there is going to be a rebrand for the female condom. So it is going to be rebranded as an internal condom, and that comes on the back of consultation with people who identify as female and who are using the female condom. We don't have a date for when the rebrand will come out, but we know that it is coming soon. The packaging will make it very clear that it was previously known as a female condom, and we're also very cautious that we want to make sure that any individuals, accessing the female condom will be aware that it's for vaginal use only, and we'll make that communications clear, and we will share that with you all as well. So it's just to reassure anybody that has any concerns about, anyone getting mistaken what the product is actually used for. During this time, we've also had to take steps to manage any potential implications of Brexit. What we did was we made sure we had a contingency stock in case of emergency, in case there was any issues with deliveries or products being developed. Thankfully, we've not come across any particular issues, so then we've just been using the stock as appropriate, but we just made sure that there wouldn't be a point where we were stuck and we had no products to share if there was any kind of issues in the chain of delivery and development as well. We have also had a bit of change of terminology. We've moved away from using venues to distribution outlets. We want this to represent the change in the kind of delivery model that our organisations engage in the service, the way that they deliver. For example, some organisations might be an outreach service, or organisations might have had to change venues, or they may no longer have a specific venue. So we wanted to ensure that the language that we were using was appropriate to the manner in which services were delivering the free condom service as well. We've also done quite a bit of work on our free condom service website. We have tried to make it more accessible, kind of more engaging, and with lots of information available to both the public and distribution outlets as well. So what I'm going to do is I'm just going to take us out of this presentation, and I'm going to just give us a wee little walkthrough of the website so that you're aware of how to access it and kind of the features that are available to yourselves on the website. So here we've got our landing page. So it's still the same address, freecondoms.scot. It is also hosted on Sandyford's website as well, but we have our own URL. So you can see the landing page here. At the top there, you've got information about the service, the free condoms by post, finding an outlet, which we are going to be working on, and this is part of our re-engagement, is to identify, you know, where our outlets are at and kind of any changes with regards to opening times. We've got our products here, so that's where you can, you know, find out which products that we have available and also sizes, and then we also have information for outlets as well. So I'll just scroll down, but you can see all the information is there. Like I say, nice bright colours, making it quite engaging. And then we go for information for outlets, so that will be most relevant to yourselves here. Again, further information about the role of a condom distribution outlet. If you have any colleagues that would like some more information, you know, what's involved in becoming a distribution outlet, how we'll support you, resources, ordering stop. And again, if you have any if you want any further information about working with those under 16. So I'm just going to take you to this page here, which is ordering stop and resources. So again, this is the easiest way to order your stock and resources. You know, it's easy for yourselves and it's also easy for ourselves because it is an automatic form. So again, just some information with regards to your outlet. Then you have the product section where you can select your condoms and lubricant in the pre-packed white bags, but you've also got your condoms and lubricant in your clinical boxes. And then you've got a section here for your resources to support you. We're going to have ask some questions around that as well. But again, I just wanted to highlight the website to you so that you know that it's there, and also just so you know that we've made it really simple for you to order, and hopefully you can access that from now on. So again, it's just freecondoms.scot. And again, please feel free to have a look on there and to signpost your colleagues and also signpost any members of the public as well. So, okay, so I'll just move on just a couple other areas that we've worked on the last wee while. We have developed an online training resource. That screen grab there on that slide there is probably not the easiest to see, so don't worry, there's nothing there that you need to take down any information about. It's just to give you, just for us a talking point. So that's our landing page. Again, just to make it more accessible. The training, you can start it and leave it and come back to it. And more hopefully engaging as well. It means you're not kind of set to having the online training that we've been delivering as well. We hope that'll, like I say, just be an easy way of engaging with the training. And also for those that are existing outlets, we encourage or we ask that the training is completed every 2 years. So capacity wise on our side and capacity wise for outlets, we hope that'll be easier. But with regards to outlets being asked to complete the training, we'll take this on a phased approach, again, just to manage the number of outlets that we do have. And finally, what we're also doing at the moment is doing a bit of mapping of where our outlets are, which outlets are open over, considering with the situation the last couple of years, just to ensure that we have venues in the right places and taking into consideration the appropriate sexual health data as well to help make sure we've got outlets in the right places. So yeah, that's some service developments that we thought would be helpful to share with you all. I also just wanted to take this opportunity as well to extend thanks to those of you that are delivering the service. Over the last financial year, you've helped us by ordering over 660,000 condoms and 212,000 packets of lubricant. So that's a huge number that you're helping us to distribute. So we really appreciate your support to help make this a successful service. I'm just going to open up the floor to everybody again and just ask, are there any areas that you require further support with or anything that you'd like to kind of ask us as a free condom service team while we're here? Again, please feel free to put your hand up, or you can use the chat function as well. If you want to, do you want to come in?
So yeah, I just wonder if there's ever been any chat about what or how it looks like in terms of handing out free condoms in the school setting rather than community setting through our school nurses or any other avenue.
Okay, so I've limited kind of knowledge around working in schools. I know that that's kind of, and probably we do work with schools through our team, but that's the young people side of the team. And I think maybe it's kind of a challenging situation to be providing condoms in schools. So it's probably not something that we're looking at the moment, but I'll ask Jo to come in here, who's got more kind of background with regards to working with schools and kind of, you know, the approach that we've taken over the last wee while.
Yeah, I'll take over the answer from Myra. So the simple answer is, within Glasgow and Clyde, it is not something that we're actually doing at the moment, as in giving them out of school. What we have worked very hard, and as Myra says, we have a separate section within our team that work with children and young people. And what we've done is we've worked very hard on the national curriculum that's been updated in, I think it was 2020. And one of our colleagues is actually very what's the word I'm looking for? She's led quite a lot on that work, and it includes information for young people about condoms. What has been agreed is at Scottish Government level many years ago is that every young person should be able to access a sexual health service or condoms within a mile of their school, and that's what we work towards. So it's working with school nurses to let them know where our actual free condom services as well as sexual health services are. However, something that Myra will be working on, probably starting autumn, end of this year, is to work with our children and young people section. We did a big, or they did a big research project last year that was called Conundrum, and that actually worked with young people to find out what they were using sexual health service wise, contraception wise, and how they would like, thinking about how they would like the service delivered. It was really sort of just scratching the surface about how they would like the service delivered. So it's now gone into a second phase of working much more, thinking about that and how that would look. So Myra will start be doing some work around thinking about what would be the best models. I think school's probably going to be a major no-no, because young people actually don't really want these available at school. What they want to know is, where can I go and get them? And that's the important bit. And sorry if I went on for a long time there, but it isn't really a straightforward question.
Yeah, no, that's perfect. Yeah, absolutely, that's great. Thank you.
Thanks, Claire. Okay, so we have a question from Anne Wallace in the chat. Is there any information in different languages for service users? We don't have them in different languages at the moment, but if you would like to share which languages you feel would be appropriate, we can certainly take that away and explore where the gaps we have with regards to languages are. We've got a question from Fiona Conway. Will there be a provision for giving out dental dams? We don't have a provision for that at the moment. Just going on the the evidence with regards to what products we should be supplying. So we don't have any plans to have a provision for dental dams. If there was any kind of data that was showing us that that the dental dams would be appropriate to support individuals reducing the risk of sexually transmitted infections, we'd explore that, but at the moment we don't have any plans to be providing dental dams. And Alison Bowman said, is there any training modules, online techniques, etc.? You may have mentioned this. So I would say the best resource that we have at the moment is our Free Condoms website. There's loads of information there, but also what we are looking to do is we have a sign up and refresher session. It takes about an hour. That at the moment is currently delivered online via Microsoft Teams, but what we are moving towards is having, we're actually in the final stages of development of an online training platform where new and existing outlets, the existing outlets, we'd ask them to complete the training every 2 years. We'll complete the training again, and it's available to them, as and when they can access it as well.
Myris, can I just jump in there? Sorry, Alison, can I just ask, are you meaning for your own outlets, or are you meaning for resources to use with other people to show them about condoms?
Yeah, hi. Yes, I was just thinking, I've been doing this job probably about 7 years now, but from time to time, I get people in who have maybe missed their depot and, things like that. And sometimes they are young, and it's just that I give out condoms, but I don't actually, in case they want to ask me how to use it, they might never have used it before, or it's just so that I know that I'm given the right technique, or in case I do get asked that question, because you know, as an adult, you think you know, but I think it's always important to. It seems pretty straightforward, and I'm sure it is, but you know, it's amazing what people's perception of things are. And
okay, thank you for clarifying that. Mary, do you want to respond to any of that, or you want me to say something?
No.
Yep.
Yeah, so our information is available on the website. So I would direct you to look at the website. We have details of the types of condoms, the sizes, and also we have information about how to use a condom and female condoms as well. So I would say that's your kind of best place to be looking at if you want to talk through that, or if you want to refresh your own memory. But also all of the condom packs that are provided do have detailed instructions of how to use a condom as well. So you can obviously use the information on our website, and as part of our training, we do go through information about, how to use a condom as well. Claire has asked, were the numbers of online condom orders higher than those previously from distribution outlets pre-2020?
Yeah, it's probably quite a difficult one because obviously the venue online orders through, pandemic have decreased massively because a lot of places were shut and weren't operating as normal. So, we can give you stats. If you wanted more information on stats, I can look into that in more detail for you. Certainly home postal took off and was certainly more than venue. While the venues were still closed through the pandemic. So it's just with the circumstances of what's going on, it's very hard to kind of judge it. Certainly venue orders now have started to kick off again since everything's opened. And, we'll probably start to see a big increase in distribution from them. But it's been a bit up and down, really, is what I'm trying to say. It's hard to put exact figures on it.
Just to jump in on the end of that, what Ali was indicating as well is that it's not actual normal times. So we can't actually just look at stats out of context, because the context was during the majority of 2020, people were told that they should be in a bubble and that they should not be having sexual relations, or let me rephrase that, shouldn't be in close contact with people that they weren't living with. So therefore, it was actually a negative impact that we had on our young people's clinics, because they were actually still having sexual activity with people outside the home. They were frightened to come into clinic because they thought they would get told off because of COVID. So it's not very much point us sending you out figures, because it's not, we can show figures from years prior to COVID, and we can start looking now to see how the numbers are picking up. But during that period of kind of 2020 to probably about the end of 21, beginning of 22, it's a very false thing to start looking at figures and seeing, did we have as many condoms going out? Because the simple answer will be no, because people weren't meant to be having contact. Why we started the postal one was temporary postal scheme, was so that where we knew people were having and needing condoms, they could still use them and fill anonymous, etc., as well as places not being open. So there's a lot to think about. You can't just go by stats.
Thanks for that. Okay, so some other comments. Rick Ellis, QR codes on the white bags would be helpful to direct to how to use, and Joe has responded saying we can think about updating the instruction leaflet that is inside the bag and include a QR code there to a video. Rosie McQuaid just asked, are we allowed to give out condoms to young people under 16? Yes, the service is available to anyone aged over 13 years. Depending, obviously, I don't know which organisation you are in, but for our outlets that are registered outlets, we are allowed to give out condoms to those aged over 13. And again, it's just if there are any concerns around vulnerability or exploitation, you just refer to your organisational or local child protection policies and guidelines as well. So yes, as an outlet, you are allowed to provide condoms. There's no kind of legal issues with providing condoms or to providing sexual health information. I can direct you to our page on our website. Again, it's information for outlets, and it's the page that says working with those aged 13 to 16. So you can refer to that, and that gives you a bit more detail. But yeah, there aren't any issues as long as they're over the age of 13. Well, like I say, I would definitely encourage you to have a look at our website. It's got loads of resources on there and information. You can signpost those that you work with or your colleagues as well for further information. Okay, I've just got a question that's come up here. So we have some out-of-date condoms. How do we discard? Okay, so with regards to condoms, they're not considered to be like medical products, so there isn't necessarily that they need to go in medical waste, but we would encourage you to think about, you know, the appropriate way of disposing of them, making sure that, you know, it's not just, you know, disposed somewhere that probably people could just pick up, you know, any service user could pick up. So if they're out of date, that's a big, you know, be a concern for us. We just want to make sure that nobody is using out of date products. So I'd say you can dispose of them in general waste, but like I say, it's just thinking about making sure that that's, you know, appropriate and it's not visible for other people to be able just to go in or be able to take some away from the waste. So that's our advice with regards to disposing of condoms. That's the kind of the main parts of the session for this afternoon that we wanted to cover. It was more just an opportunity to bring people together, start that re-engagement process as well, and make sure aware of what's been going on for us in the last wee while. So just to kind of round up before we finish, I'd like you just to kind of share in the chat, if possible, what is one learning point you've taken from this afternoon's session. So feel free to put it in the chat. If you would like to raise your hand and share with the group, that's fine. But if you want to just pop something in the chat, that's absolutely grand. I shared the changing of branding for female condoms. Yep, so that is coming soon. So we'll let you know. And I should have noted as well, we're having issues with the stock of female condoms at the moment. So we're hoping that will be resolved and we will be able to provide female condoms again. But we'll be in touch with everybody when we know once we're able to provide the female condoms again. Okay, so some people are just saying wasn't aware about the age criteria for issuing condoms. So another learning point is about the postal service, the training available, the age, and how easy it is to access the webpage. And Leslie, it's new to post. It's been good to put some faces to names and hear about the service works, especially order by post. That's fab. Well, that's really great. That's what we're hoping to get from this, is for some that are new into post, and just a bit of a refresher for people as well about how we deliver the service. Okay. And Kirsty shared, good to know you can direct service users to our website. Yeah. Hopefully you find the website to be a helpful resource. So please do. Yeah, please do direct service users to the website and your colleagues as well. I'm just going to move on now and ask the group just to share what you feel you would put into practice after coming along to this session. So Kira has shared with regards to putting into practice, both service users to utilise the postal service and information available online. Okay, fab. That's great. We've got normalising using condoms for young people. That's great to hear. It's exactly what we want to try and achieve. Looking to work with you to increase outlets for distribution in Renfrewshire. Yeah, so we'll be working with our locality teams to help us make sure that we've got our outlets in the right places. Leslie's going to check all our stock is in date to get ordering. Also pass on the website details to my colleagues who work specifically with teenagers. So yeah, that's fantastic. It's really important to ensure that all stock is in date, that you've got the right type of stock as well. And we're really, you know, in a good position with the service where, you know, once you order, you should receive your products within 10 days directly from Pasanti. So it means you don't have to have too much stock in one go, helps reduce the risk of stock going out of date as well. But totally understand with the circumstance of the last few years, that's happening with people that, you know, need to have a check of stock and see if it's in date. Claire shared promotion of the website, signposting, possible uptake of more distribution outlets. Alison shared we're using the online ordering service instead of sending an email. That's great. Hopefully that'll save time for you. And Alison Bowman has shared great to have update and good questions from others. Be good for my patients to know where they can access them from GP surgery, not just when coming in for their appointment. And we'll pop a poster up. Fantastic. That's great to hear that as well. Alison has just shared there, Alison from our team has just shared that we're looking to update resources, including posters. So yeah, that's really helpful for us to get that feedback about the types of resources you would like. And Grant Claim is shared to promote the website to service users via the website. So that's fantastic. It's really good to hear all these different ways that you're going to take some steps and put some things in place following the session. So that is the kind of main things that we wanted to cover during the session. As I say, starting our re-engagement, really appreciate you taking the time to come along this afternoon. And to share your thoughts, to help us think about how we're going to shape the service moving forward as well. And it's just a really great opportunity for me, being new into the team, to get to meet some people, although albeit virtually, get to see some, put some faces to names that we see coming through. And hopefully you've found it beneficial just for understanding of the direction of travel that we're moving towards, and how we're delivering the service as well. So thank you so much for supporting us, for helping us to get condoms out there, making sure they're reaching the right people. And as I say, just a reminder, you can check your stock, sure you have the appropriate products, and as you've got the website here, you're more than welcome to order some products as well. So thank you very much. And just the final slide here, again, it's just a reminder of our website there, where you can order your stock, and if you've got any further queries, you can get in touch with us at freecondoms@ggc.scot.nhs.uk. On behalf of ourselves in the Free Condom Service, thank you so much. We look forward to kind of working with you in the future, being in touch, and we really appreciate your feedback to help us, develop the service. So thank you so much.